All right. Well, hello everyone. I have 6:30. I'm in Kansas City, so Central Time. So we are going to go ahead and get started. Thank you everyone for joining for this is our second Family Services webinar of 2020. Today's topic, as you can see, is oral health care and its impact on the person's overall well-being. So my name is Hope Newport, and I am the Family Services Manager here at the International FOP Association. I wanted to just go over a few kind of important things for you to point out for all of you before we get started. So as you may have noticed, all of our attendees are muted, and this is just to prevent any background noise coming in. You can all submit questions if you have those for our panelists through the chat feature, which I submitted a question to. And you can also submit them through the Q&A feature, those are both located on the bottom toolbar of your screen, of your Zoom screen. So please feel free to submit any questions as you have them throughout the webinar. We will answer all of those questions at the end. So if I don't address it when you submit it, it's just because I'm waiting for the end of our presentation, and we will get to those questions then. I also wanted to let everyone know that a recording and slides with links from today's webinar will be available later this week. So don't feel the need, if you're a note taker, to feel like you have to scribble everything down. You'll be able to access all of this later. And I wanted to let everyone who submitted questions before the webinar, thank you to everyone who did that. We wanted to let you know that most of those answers have been included in the presentation, and if we didn't include your answers, we'll address those at the very end as well. And also, just to give a disclaimer for everyone that we're going to be talking about several different tools and resources, but the IFOPA is not affiliated with any of the products mentioned during the webinar, and we don't endorse any one particular product or brand mentioned. They're just examples of tools that may be helpful. So our panelists today are Dr. Clive Friedman and IFOPA Family Services Coordinator Karen Kirchhoff. So Dr. Friedman is no stranger to the FOP community. If you have been to a FOP Canadian family meeting or to one of our IFOPA meetings here in the US since 2013, you may have seen him give a talk about oral dental health, and he also has led our Ask a Dentist meetings to provide one-on-one opportunities for families to ask questions about their dental care and concerns they have. So his longtime commitment to the FOP community and his interest in people with special needs, prevention, education, and wellness have all led to him being a really invaluable resource for our community. And we're so lucky to have you, Dr. Friedman. So we just want you to know we appreciate all you do to support the IFOPA and the families we serve. And Karen Kirchhoff joined the IFOPA last fall as our Family Services Coordinator. She is the main staff contact for our Ability Toolbox program, which hopefully you've all heard of, and also the Harold and Elaine Kaplan Quality of Life Awards program. So she leads our efforts to really connect individuals with FOP and their families with the tools and the resources to live as fully and independently as possible. So with that, I will turn it over to our two panelists and let them get started.
Thanks, Hope. Really appreciate you having me here. And I really wanted to give folk who are listening some kind of a background. Unfortunately, I can't see you all, so I can't see who's online and what your responses are, but you do have an opportunity to ask questions. So really, why did I suggest to Hope that we have this webinar? Over the many years that I've attended family meetings, and the last one being in Florida, I've come to notice that a good 25 to 30% of the individuals who are coming in have severe problems in terms of their oral health. Now, we're not talking about individuals that don't have access to care. Most individuals with FOP do have some access to care, and yet the oral health component of the overall health needs is not being taken care of, and it's something that is both concerning to me and also I'm very curious as to why this actually does happen. So I wanted to identify something in terms of why it's really important for us to be functioning and looking at the oral health needs of individuals with FOP. So here's a slide of an individual who's completely enclosed. His mouth only has 1 millimeter of opening. And this is an individual who has relatively good oral hygiene for the individuals that I actually see. And yet you see a lot of debris, you see a lot of decay in these areas, you see a lot of wear on these teeth. And in order to actually fix this person's teeth is a very, very complex process. And so my focus has always been and will be, how do we prevent this from happening? How do we prevent you from needing to go in and having a general anesthetic to fix any of these teeth? So let me ask you a question. Which of these rivers would you prefer to swim in? Just take a moment to think about which of these you would be more likely to want to go for a swim. And if you have a look at this picture on the left, there are a lot of things that go towards making this a pristine river. And there are a lot of things that make this here something that you are not going to want to go into. So I'm going to give you a suggestion that we begin to think of our mouths as a river. And that that river is constantly flowing, and there's many, many different things within our mouths that are going to relate to the overall health of our mouths. And we'll talk a little bit more later in terms of what are some of the things that cause the destruction that you're seeing on the right as opposed to what you're seeing on the left. So if we look at oral health as a overall perspective, many individuals think that oral health is just the teeth and the gums and that you need to brush and floss every day and not eat sugar and then you're going to be perfectly fine. However, oral health really is something way more than just gums, teeth, and bone. It is a function of how we eat. It's a function of how we breathe. It's a function of what we eat and how we eat. We need oral health in terms of communicating, and we need it to pick up energy, perceive things in our environment. And so when I talk about oral health, I'm not only talking about the health of your teeth or your gums. So for many individuals, they're not really aware of the overall impact on the general well-being of a person with respect to their mouths. And that's why I'm always curious as to why individuals with FOP seem to neglect their mouths, where a lot of the other areas of their body they focus on and they take really good care of it. But the mouth is something that is neglected in many, many instances. And I totally understand that folk with FOP are living in very complex circumstances, and just one more thing is not something that you want to look at. But let's have a look at how oral health can impact everything that happens in our bodies. So if you think of that stream and you think of the mouth as being the source of that stream, if you will, everything that goes into your mouth goes into your gut. And so your gut health is related to your oral health. So your gut health is related to the rest of your body's health. If you don't have good gut health, then you don't have good brain and immune systems. And so it starts with our mouths. And if our mouth is not healthy, how can the rest of our body be healthy? Karen, I know, put up this slide related to nutrition and probiotics and prebiotics. And it's something that we can get into later on if this is something that people want to know, but I'm not going to go into detail because I'd like to go through this as shortly as possible so that you have an opportunity to ask questions. So folk will ask me what is important about breathing and the respiratory system in terms of oral health and how does it work? What we oftentimes are not aware of is that if we breathe through our noses versus our mouths, it can impact many issues related to overall disease. So when we breathe only through our mouths, and so oftentimes, especially with individuals with FOP, when you have some kind of instability or neck ankylosis, and the neck is fused in a particular position and you can only open your mouth in a particular way, you end up breathing more through your mouth than through your nose. And that can impact how the air is sterilized going into your body, and it impacts how the lymphoid tissue responds. And so it also can impact how the river, if you will, dries out. So if you've got a drought, all the fish in that river are going to die. If you mouth breathe and you have a dry mouth, a lot of the cells and the bacteria cannot function like they would normally function. And then something else that I've noticed, especially in individuals with FOP, is many folk have what I call a tongue thrust swallow. It's where the tongue does not swallow in a correct position. And what that ends up doing is, I find in the family gatherings that I've seen, a good 20 to 30% of individuals who have this tongue thrust swallow also have recurrent flare-ups below their mandibles. And I've discussed this with Dr. Kaplan and Dr. Pignolio, and we really don't know if it is a correct fact or not, but it's something that I have observed and am interested and curious to see if this is something that we should be looking at long-term. Oral health impacts our cardiovascular system. So when you have teeth that look like this, and these teeth have got debris, calculus, plaque on them, and every time you eat, this debris or this calculus, whoops, go back, can release from the tooth, and if that's inhaled, it can get into your lungs and cause chronic lung infection. But this inflammation has also been related to chronic heart disease. So inflammation as a whole is related to the overall health of our bodies. And when our mouth is chronically inflamed, how is that impacting the rest of our bodies? So I want you to think about that again in terms of that river picture that I showed you, in terms of what is making it healthy and what is it making not healthy. If we do not have good oral health, then it impacts our ability to communicate. Now, for many individuals who are fully ankylosed, that you'll note the difficulty that they have with communication, or you get tired when you're talking with your mouth closed all the time and you can't understand. You may notice, by the way, during this presentation that I start mumbling, and I'm going to actually ask Karen and Hope to let me know if I do so, because at this point I actually have issues with my tongue, and what happens is when I'm tired, I start to mumble because my tongue is not functioning normally. So Karen, please let me know if that is happening. And
doing great so far, Clive.
and I will show you what I do to help me out. So this is not unusual, again, with individuals with FOP. So it's really something that I want you to begin to expand your thinking about in terms of what makes my mouth healthy, what makes my overall jaws and head and neck healthy, as opposed to how can I, what makes it problematic. Now, and I totally understand that individuals with FOP are going to have some issues. They're going to have ankylosis of the jaw. They're going to have ankylosis of the neck muscles. They're going to have inability to move their necks. And all of this just makes things that much more complex. However, given all of that, there are things that we can do to minimize the impact of that. Oral health and self-esteem and your quality of life. There's not a lot that I need to say about this. People are very aware of how these kinds of things can actually impact. So much of what we see in our culture is related to our smile and our ability to talk. And when we can't do that, the perception of how people see us differs dramatically. There wouldn't be the whole culture of aestheticians if this was not true. So I think it's really important to think about, it's not just what's inside our mouths, but it's what's outside on our face as well. So we come back to this picture that I've shown you in terms of what is health. And the question that I ask of you is, why do you brush your teeth? Why do you floss your teeth? What is the purpose of doing daily oral hygiene, of doing daily health? And if you have a look at these pictures, we start to begin to think of what is the purpose of why we do that. So every time we eat or drink a Coke or a pop or a sugary food or carbohydrate, or do something that results in this kind of happening, and if we don't clean that up, then we end up with this circumstance as opposed to this circumstance. So in more scientific language, what we're looking at is we're looking at a biofilm. All of the bacteria in our mouths, and we have over 700 bacteria in our mouths. All of those bacteria collect as a form to create what's called a biofilm. And what that biofilm does is it is recreated every 24 hours. So it's the collection of the bacteria in our mouths. And what happens is we need that biofilm for health, but we also, that biofilm also acts as a repository for disease structure. So when we have a biofilm that is, let's say, not good, then it will end up creating toxins and breakdown of tooth structures. So what we're looking for is we're looking for a biofilm that is good, a healthy bacteria, rather than bad bacteria. So let's take another analogy and have a look at these two swimming pools. Which one would you want to swim in? I don't think that you're going to want to go into this very quickly. What you're seeing in that bottom photo is a biofilm. All of that green muck is essentially the buildup of organisms within and collection, and it has not been cleaned, whereas the top photo is really clean. So what is it that allows us to keep that river, keep that swimming pool in our mouths constantly clean, so it's looking like this top picture? And that's what brushing and flossing does. Every time we brush or floss, we disrupt that biofilm, and we don't allow it to actually stick to our teeth, stick to the sides of our cheeks. And it's when it sticks to the teeth that it has much more ability to collect or to break down food into the toxins that cause the inflammation and cause the gum disease and cause cavities in your teeth. Now, Oftentimes you'll ask, well, why should we use toothpaste? What toothpaste does is it helps the disruption of the biofilm, but more importantly, a toothpaste with fluoride is much like putting chemicals, chlorine, into that swimming pool. Fluoride is putting that chemical, if you will, into your mouth that helps not only the disruption, but helps the bacteria from growing and sticking to the teeth. And many of the materials that Karen is going to go through actually work on different aspects of that biofilm. So I wanted to focus primarily on this aspect of why we keep our teeth clean so that individuals understand the importance of brushing and flossing. I'll oftentimes ask folk how often you brush, and they'll say twice a day, 3 times a day. And how often do you floss? And they will say once a week. And I'm curious about that because the brushing only gets at the outsides of the teeth and it never gets between the teeth. And flossing is what gets between the teeth. So what we're doing is by only flossing once a week, we're only disrupting the biofilm between the teeth once a week as opposed to twice a day. And what's important to recognize is that every time we brush, we're disrupting that biofilm, but it recurs within 24 hours and it's sticking to the teeth. And that's why we need to brush and floss on a more regular basis. So Karen, I've gone through that very quickly. And there's lots more detail and science that I can give, but I wanted to keep it as simple as possible today and give Karen an opportunity to go through a lot of the questions that people really want to know.
Yeah, so I actually am going to try to keep this as brief as possible because there is a lot of information and we have broken this down into age categories to show a little bit of the differences as you get older, what needs to change. So this first slide for infants to roughly 3 years of age, a young toddler, I'm not going to go through these. You're going to have access to this after the presentation this evening. But I did want to point out that even though kids don't have teeth when they're infants, you do still need to sanitize their gums. And then once they do have teeth, it may not be necessary to use fluoride toothpaste. Clive, do you want to elaborate on that? Because you may not need fluoride at that young of an age.
Yeah, that's a great question. So fluoride at a very young age, we do not like to use if the individual is low risk. And we determine risk by a number of things, primarily history of disease in the family, oral health, whether the baby teeth have got staining or white spot lesions on them. There are a number of things that we look at in terms of risk. So if you're at relatively low risk, we don't go with a fluoridated toothpaste, especially if you're living in a fluoridated area. If you're living in a non-fluoridated area and if you've had your fluoride tested and you have no fluoride, there's no harm in babies actually getting a little bit of fluoride because it's acting like that chlorine, as I said, and it helps keep the mouth really clean. And the thing about fluoride in toothpaste is low doses of fluoride over long periods of time have been shown to be much more effective than anything else. So it's like putting small amounts of chlorine into your swimming pool on a daily basis rather than shocking it once a month. I think that's a good analogy to use.
So as far as tools then for infants, if they do not have any teeth yet, we do have examples of maybe some gauze that you would just wet down with some water to rub over the gums. There are products like tooth and gum wipes. It's not necessary to buy something like this, but if it's something you prefer to use, you're more than welcome. And then there's also things like oral sponges that you can use to rub over the gums. Now, I know with the gauze, you would wet that down with water. Do you need to do anything to the oral sponges, Clive?
So again, what's important here is not what you're using. You can be using as many different textures as you like, as many different things as you want. what you're wanting to do is you want to get that individual used to having different textures, actually massaging the gums. And the more you massage those gums and the more you get hardening of those gums, the less teething issues you're going to get. And those individuals are going to get used to those different textures in their mouths. So what you're using doesn't matter. Using water on something like that oral sponge is really useful again. But sometimes I might even use a gauze without it being wet. It depends on the kid and it depends on where you're at. And it's just trying to get as many different textures. You could even use a face cloth here. So there's, you know, what you've got here are some examples. And I want to just repeat what Hope was saying, that none of these things are endorsed by OFOPA. When I recommend them, I'm not necessarily recommending one over another. These are just examples for you to have.
And same goes for these brushes. For toddlers, once they do start to get some teeth, play around with what works for you while you're trying to brush your toddler's teeth, whether it's a finger brush or on the right, one of the full contact brushes that gets both sides of the teeth at once. We did especially like these brushes in the middle that a child can hold themselves and chew on and just get used to the experience of having a brush in their hands and learning that a toothbrush is for going in the mouth and to desensitize, to be able to chew on something and have a positive experience with it rather than a parent trying to force their way into a child's mouth.
So to add to that, Karen, these brushes here, for example, where you're getting an individual really biting on them is really excellent because we're encouraging the biting movements. North America has become way too conscious about having mushy and liquid foods, and we're forgetting how to actually eat properly. We're forgetting how to use our jaws, and this actually helps encourage individuals using their jaws. So we want to do that. This brush on the right is really useful, especially if you've got an individual who has a young kid who's already got some closure of their mouth and it's difficult to get a toothbrush in. This will get to both sides, the inside and the outside and the top, all simultaneously. Really, I think it's important to speak to your oral health provider to determine what is going to be best for your particular child.
Yeah, and these are just some examples of some of the toothpaste that I found without fluoride. There are probably many out there, but one of the things to look for is if it does use xylitol as the sweetener in the toothpaste, it's actually good for the tooth versus an artificial sweetener or a sugar.
So xylitol is really one of those things that's a chemical. Well, it's actually not really a chemical. It is a natural material that comes from trees. And xylitol is an interesting one because it does a number of things to the bacteria in our mouths. It actually decreases what we call the virulence. In other words, it decreases the ability of the bacteria to produce acid, and it also decreases the numbers. So it's working on that biofilm. It's keeping that swimming pool clean. It's keeping your mouth clean.
So for children 3 to 5 years of age, the guidelines are roughly the same. You still want to be brushing at least twice a day, 2 minutes, flossing daily. The difference here is that we do want to now start adding fluoride toothpaste. But if a child is still in the habit of swallowing some of the toothpaste, we are going to want to limit the amount of toothpaste we're putting on the brush. So just about the size of a rice grain. If they are able to spit and not swallow, resist the urge to swallow, then we can move to a pea-sized amount of toothpaste. And I believe the next slide kind of gives a graphic of the sizes and the amount of toothpaste.
One of the things I wanted to point out, Karen, is that for kids up until the age of 3, I generally don't recommend toothpaste because so many of the commercial toothpastes have sweeteners in them. And then kids learn to swallow the toothpaste. And then when you get to a fluoridated toothpaste, you have to teach them to stop swallowing the toothpaste. So you can do as good a job just disrupting that biofilm with the bristles of the toothbrush as you can, whether it has toothpaste on or not.
And then this is a normal, just a regular toothpaste. The 1,000 parts per million of fluoride, that is a typical amount of fluoride, and that is going to be safe for children 3 to 5, 3 to 6 years of age. It isn't going to be until they get older or are having more of a risk factor for oral disease that you're going to want to increase that amount of fluoride in the toothpaste. Child toothbrushes, so again, you're wanting to get them engaged. There's going to be lots of colorful ones. There's going to be ones that have characters on them. You do want your child, even though you're going to be brushing their teeth to be most effective, you do want them to be able to hold the brush themselves. There's gadgets out there like grippers that you can put on the end of toothbrushes. You could do the same thing with a tennis ball so that a child can grip that small handle of a toothbrush themselves, or something even as simple as wrapping a washcloth around the handle and holding it in place with some rubber bands. Just making sure that whatever you do is something that works for you and for your child. The last picture I have shows even another gimmick where you could use an electric toothbrush that maybe plays a song for the full 2 minutes that your child needs to be brushing so they don't stop brushing until the song is done, or it maybe has a timer that's included with it so a child can visually see how long they need to be brushing. And I just want to take a minute here too, Clive, to sidetrack a bit to talk a little bit about the conflict between manual brushes versus electric brushes. Is there one that's better than the other that you professionally recommend, or what should people be choosing?
So there's two things that I want to do before I get to the electric toothbrush. How long should you be actually brushing your kids' teeth for them? Kids don't have shoes with shoelaces anymore. But in the days when you had shoelaces, we would ask a kid to tie their own shoelaces. If they can tie their own shoelaces, they have the dexterity to brush their teeth. So that's how we would determine. But most children, most individuals don't have the ability to brush well on their own until about 7, 8 years of age, and they don't have the ability to floss until about 12 years of age in terms of dexterity. There are lots of adults who don't have dexterity, but I'm not going to go there. So in terms of electric toothbrushes, there's no really good evidence to show that one is better than another. However, in individuals with FOP where you have limited movement, the electric toothbrush is going to do the job for you where the mechanical toothbrush cannot. As long as, and I'm going to repeat this, as long as the electric toothbrush is being used effectively and appropriately. We do not use an electric toothbrush in the same way as we use a manual toothbrush. I'm going to repeat that. We do not use an electric toothbrush in the same way as a manual toothbrush, and it's best actually to have your oral health professional show you how to use the electric toothbrushes because there are very many of them. And I'll oftentimes say that Colgate was very good for dentists because they have these little $5 jobbies that don't work at all and creates all sorts of hassles. So they're not going to like me.
They won't see this.
It doesn't really matter. What's important is how you use the toothbrush. So oftentimes using the electric toothbrush can take longer and is more difficult than the manual. So please be in touch with your oral health professional and ask them what is the best way to use the toothbrush that you actually are using. So take it in with you and ask them to show you if you're using it correctly.
And I think the same thing could probably be said for flossing aids as far as dexterity. You're going to see a lot of fun flossing aids for children from 3 to 5, 5 to 7 years of age. But a parent needs to be doing the flossing for them because they're not going to be effective enough to do it themselves.
And just remember this bottom line here. Remember to rinse the floss aid after each tooth because you want to prevent moving bacteria from one side of the mouth to the other. You've disrupted it. Now you don't want to move it to an area that was perhaps clean.
Mm-hmm. And something I just wanted to talk about really quickly before we move on to older aged children is that younger children start to really want the gum, they start to really want the candies and the sweets, but you can find some products that do use xylitol as the sweetener, which if you remember us talking about the non-fluoridated toothpaste that has xylitol, you can also find it in these types of items that are a sugar substitute so that you're actually promoting good oral care for your kids. This is a product, another one that might be worth mentioning when you are teaching younger kids how to brush. This is just a red coat tablet that will show you how much plaque is left on the teeth when you chew it, so that kids can visually see if they're being effective with their toothbrushing or not. And Clive, you said that it is pink if it is recent plaque, but
Yes.
purple?
Yes, if you get this and it's purple, it's been there for over a week.
Over a week. So these might be an effective teaching tool when you are teaching your kids how to brush more effectively on their own, to show them, hey, did I do a good job, or did I still leave some plaque on my teeth?
So oftentimes you'll tell a kid to go brush and they come back and they say, yeah, I brushed really well. And you say, okay, let's go do the red dye tablet and let's see how well you did it. And I know my kids used to say, it's okay, Daddy, I'll go brush again. So, so it is a very useful tool to determine whether you or the kid is doing a good job.
So moving on to older children, children 5 years of age and older, even up into teenagers, if their jaw has not fused. Guidelines, again, are roughly the same, but this is when a professional may start recommending some higher dose fluoride toothpastes or some higher dose fluoride rinses. I think we have some examples of those. So something I learned when preparing for this webinar was that, Clive, you said actually if someone is effectively brushing their teeth, they may not actually need one of the rinses. On the previous slide, it has just some basic examples of the normal fluoride dose mouth rinses that we see every day. But those may not be necessary if the child is effectively brushing their teeth, correct?
Correct. We only really need a rinse if we're wanting to, if we don't have the ability to fully disrupt that biofilm using the mechanical means. And then the rinse is going to help you to do some of that. And it depending on the rinse as to what it does and how it works on that biofilm is going to work. So again, check with your oral health professional as to which is going to be the best rinse to use under what circumstances.
And same with these higher dose fluoride toothpastes. This will be prescribed to you from your dentist, so you need to be in communication with them as far as if you are at high risk. And I do believe that as you get older, Clive would consider everyone with an FOP diagnosis as high risk. So this is definitely something you want to talk to your dental professional about as to whether or not you need this higher dose toothpaste.
So as soon as you are able to not swallow any toothpaste and you are spitting, I do regard every individual with FOP as high risk. I never ever want to get in and do a filling, and I never want to do a general anesthetic. And if I can manage the risk of you getting any kind of gum disease or tooth disease, and if we can use something like this high dose fluorides to minimize that from happening, the better.
And once that child does reach the dexterity that they are able to floss on their own, there are obviously a lot of different options. The floss picks are nice because they are disposable, but even if you are using those and disposing of them, again, you do need to rinse in between each tooth that you're using that floss pick. Or if you do have enough space in between your teeth, you may want to use an interdental brush so that you can really disrupt that biofilm if you're able to get those brushes in between the teeth. They do come in different sizes, so depending on how much of a gap you have in between each teeth, you might need a certain size. They have little ones that you can hold, but if you need a longer length, if you're a little bit limited in your mobility in your shoulders, you can have longer ones. It might be a time to start talking to your teens about tongue cleaners, because again, we could be great with our oral health, but we kind of forget about cleaning our tongue. And then something I did learn from Clive, and Clive, I'll let you elaborate on it, but using the water picks and the air picks, they are great for dislodging food in between the teeth to get out of difficult places that maybe we can't reach, but they're not necessarily disrupting the biofilm. So it's not taking place of brushing the teeth. You can use different substances in the water pick. I think, Clive, you mentioned using a diluted hydrogen peroxide. Is that right?
Correct, yes.
So
So the diluted hydrogen peroxide is going to have an impact on the bacteria. The chlorhexidine would have an impact on the biofilm. So it's what's in there, but if it's just straight water, it's not necessarily going to have an impact on that. And I would just point out that these brushes here can be very useful if you're completely ankylosed, if your teeth are completely together and you're wanting to get through where you can't floss correctly, then these become something that is more, it's a little easier to get in between and sometimes even on the insides of your teeth. So changing the shape of these, you can maybe clean areas that you may otherwise not have been able to.
And that is kind of what we want to move into next, because I think a lot of people that have joined us tonight do have some ankylosis of the jaw and are wanting some of these guidelines of what to do to get better dental health care. So you do want to continue brushing the surfaces of the teeth that you still can reach on the cheek side of your mouths. But some of these tools, yeah, you could go ahead and go to the next one, Clive. Some of these toothbrushes are a little bit more of a specialty toothbrush that might help you get to areas that a normal toothbrush can't get to. So maybe you have a little bit of an opening or a little bit of a gap in between your teeth. Or maybe you have a little bit of an overbite that you can still fit one of these specialty brushes in, or maybe even you can fit a child-sized toothbrush still on the insides of your mouth. But any amount of brushing that you're able to get on the inside of your mouth, if possible, is going to be better than just a rinse. So these were just a couple examples of some smaller heads, some different angled heads. This last blue one on the right, it does have really long brushes, but if for some reason the angle of that brush worked, you could always even take a pair of scissors and cut those brushes down a little bit to help them fit through any kind of gap that you may have.
These are very useful for the very back portions of your mouth, right at the back. And one of the things I do want to remember to identify is toothbrushes wear out. So after 6 weeks, if the toothbrush bristles look like they're frayed, change them, get a new toothbrush. Using a frayed end toothbrush can actually cause extensive gum disease. It can rub away your gums dramatically. And so you want to make sure you have a healthy toothbrush bristle at the end. So I would get a little concerned with cutting that with the scissors because it's going to affect the margin of that bristle. So rather go with one that's got a shorter head rather than cutting them, because I wouldn't want you to brush the gums away because you've done that.
And then there are different types. These are just some examples of if you do have ankylosis of the jaw. These are also some of those interdental brushes that maybe come with a little bit of a different angle, or the one on the left that looks like it would be very difficult to hold. It actually inserts into the little tube that's just to the right of it. So it's like an extension. And then you can bend the bristles at the very end if you needed it to be at a certain angle to get towards the back teeth, in between the back teeth. So again, these are going to be very effective tools for you to use, both for trying to disrupt the biofilm and just for getting food out from in between the teeth. Anything that's dislodged that you can't reach if your jaw is fused. Now, some of the products, these are things that your dentist is going to prescribe for you. Again, the high dose rinses. If there are parts of your mouth that you're not able to get touched by a brush, then you are going to have to use one of these high dose rinses. There are also some products like a tooth mousse or an MI paste, which not only it's a little bit different, and Clive, you can tell us kind of the difference between the rinses and the mousse, but the mousse is great if you have that dry mouth that Clive talked about earlier, where when your mouth is dry and your saliva isn't there, the biofilm can change, and that's when it starts attaching to your teeth and creating some tooth decay. So this tooth mousse is something you can use, especially in the FOP community. If you are in any kind of clinical drug trial that might have a side effect of drying your mouth out, this might be something that's very effective to use in between your teeth brushings.
So there are a number of salivary substitutes, but I find that this is one of the nicest ones. It does not have, this one has fluoride, the plus, but the ones that don't have fluoride, it's made from milk products. It's really comfortable. It attaches to salivary protein and it sticks around for a long period of time, and it just keeps the mouth moist. But as well as keeping the mouth moist, it does a number of other things too. It can affect the pH of the mouth, and it can also affect the ability of your mouth to buffer saliva. And these are important aspects in terms of having a healthy biofilm and a healthy oral environment. So some of the things that create that nice, beautiful river that you would love to jump into. So again, discuss these things with your oral health professional. There are lots of different ones on the market, but these are some of the ones that I find easier. These are not available in pharmacies, and I think you have to get them directly from your dentist, at least in America. If you live in Australia, they're available in the pharmacy.
Now, I do want to take just a quick note. We have been talking a lot about ankylosis of the jaw, but there are other mobility restrictions that might limit how well you're able to brush your teeth. Like if your neck is fused in a certain position, or if you have limited shoulder and arm mobility, you may need some tools strictly just to help you get the toothbrush up to your mouth. So there's different things like the grip tubes and the silicone straps if you are having difficulty just holding a toothbrush to get it up to your mouth. Right in the middle, the hemostat scissors. This is actually a great tool that you can use if you're wanting to use some of the interdental brushes. These scissors actually lock close and will grip whatever it is that you put in the teeth of it. It will grip it pretty tightly, and you can then extend those hemostat scissors up to your mouth. So if you're not able to get your hand all the way up to your mouth to use one of these little flossers or interdental brushes, the hemostat scissors might really help with that. Same with this giraffe tool, the purple giraffe tool. It's an extension tool, and it has two different heads that have a spring inside that will hold pretty much anything that you might want to stick in there. There's a smaller head for smaller items, like makeup brushes or an interdental brush. The larger head could maybe hold a razor or a toothbrush, but it will extend to different lengths and at different angles, and that might help you get something up to your mouth to help brush. And then I did even have a community member share that dowel rod, the electric toothbrush duct taped to a dowel rod that helped him get that up to his mouth to clean a little bit more effectively. So definitely reach out to the IFOPA, the Ability Toolbox program, and we can problem solve what you might need to make things more accessible for you.
So Karen, if I'll just talk to this very quickly, there are many different things that you can have a look at from within the dental office and what you can do in terms of care at home. There are very different, you're seeing a lot of different products here. Each one does something different to that biofilm, and it's dependent on what the environment is in your mouth is what's going to work best for you. So in discussion with your oral health professional, decide between you as to what's going to work in your best interests long term. We just don't have time to go through the detail of this at this point.
Yeah, and before we get to questions, we're getting close to the end, but I did want to really emphasize the importance of cleaning all of your dental tools in these crazy COVID times. I found it really ironic that I searched and searched and searched, and this was the only resource that I found that actually mentioned oral health and cleaning as part of the COVID precautions. We talk so much about coughing into our elbow and washing our hands and distancing ourselves from people, but we have not heard hardly anything mentioned about the oral hygiene, but making sure you're brushing 2 to 3 times a day and changing that toothbrush if you do have some kind of a cold or infection. Really important to keep your mouth just as clean as your hands, because that, again, as Clive said, that is where everything is going into. Everything going into your mouth is spreading to your whole system. I did share a slide here of how to actually clean those dental tools. So the first 2 bullets are just about rinsing after each use. You want to rinse your toothbrush after you use it each time. And then again, those flossing aids, if you're doing dental floss, you do want to rinse it in between each each tooth that you're using it on to avoid contaminating what you might be pulling out of one tooth and just inserting it into the next tooth if you're not rinsing it. But as far as sanitizing it, you definitely want to sanitize your toothbrush too. It's the same thing as the dirty river and the clean river. Do you want to put a clean toothbrush into your mouth, or do you want to put a toothbrush that has been sitting in a dirty toilet into your mouth? So you want to sanitize that toothbrush at least once per week, and definitely after you've had a cold or some kind of infection. And you may even want to replace your toothbrush if you've had a significant cold or infection. But like Clive said, if the bristles are splayed or worn, or at a minimum, just every 3 months, it's probably smart to completely replace your toothbrush.
Hydrogen peroxide has been shown to actually be effective against COVID.
Perfect.
So I think I'm going to answer some of the questions that came in prior to the webinar. And then we're still going to probably have a little bit of time to see if there are any questions from the actual webinar. So one of the questions was how long I should brush for. My answer to that is until your teeth are clean. So and it depends on dexterity. So if you've got an individual who has a lot of difficulty brushing, and it's very hard for you to get into your mouth, and it's going to take a lot of time and effort to do that. Think about what I was saying in terms of the disruption of the bacteria. So if you need to, brush the lower right and the inside of the lower right in the morning. Before lunch, brush the left-hand side. After lunch, brush the top. So you don't have to do your whole mouth in any one session. Do it and take time, but do it really well so that by the end of the day, your whole mouth has actually been cleaned extremely well. So how long you should brush for really depends on your dexterity, your ability, what you're doing, what materials you're using. So it's until you get it clean. You want to get that disruption of the biofilm in a really clear way on a daily basis. And that's what's important. Should a person with FOP have their teeth cleaned by a hygienist, and how often? I don't think it has to be by a hygienist, but you want to get your teeth cleaned on a regular basis. So if you are an individual who has difficulty keeping your teeth clean on your own, and you don't have the ability, you want that shock treatment that you would give to that swimming pool. And that's what your dentist can do. You can get that shock treatment of that chlorine by your hygienist or your dentist or your oral health professional, and do it as often as you need. It could be done. I've got individuals who come in once a month. I've got individuals who come in 3 monthly. I've got individuals who don't need it they only need it once a year. So again, it's based on your own needs, what your abilities are, and what your access is. What you recommend to clean behind the teeth that has plaque buildup, especially when you have jaw mobility. In this instance, I would highly recommend using a mouth rinse that can actually do something to disrupt that biofilm, that plaque. So you can do both a rinse as well as some of those interdental brushes. And so this again is where you can check out which is the best rinse to use based on the age that you are and what your abilities are. FOP does not necessarily cause teeth to move necessarily. I have not really seen that, but it depends again on how you're biting your teeth and the manner in which your top jaw and your bottom jaw come together. But FOP in itself should not cause your teeth to move when you have a flare. And we are not, we don't have any literature to show whether orthodontics creates flares or not. One of the things that I have identified in the guidelines is that when we are having orthodontics, we want to have orthodontics that gives as little pressure as possible. And that's why I've recommended doing Invisalign rather than the normal kind of orthodontics. But there are many individuals with FOP have had full orthodontics without any problems whatsoever. So just because you have FOP does not mean that you cannot get orthodontic treatment. When my jaws fused, should I have extractions? My recommendation is yes. But again, that is dependent on how your jaws come together. So an individual can have a jaw fused where there's space between the front teeth and the back and the top jaw and the bottom jaw. But if there's no space and if there's issues with throwing up and you can't throw up, you don't want to inhale any vomitus, and you want some place that you can have a hole that you can actually let that out. It also helps with eating. So again, this is a question that if you have an individual concern with respect to that, please don't hesitate to contact me, send me some questions, send me x-rays, and I can suggest to you whether it's something you should or should not get. In the Florida meeting, I think I saw probably about 12 individuals with full ankylosis, and I recommended extractions in almost every one of them because the back teeth were so completely broken down that it was causing disease anyway. And so if you can't get back there to clean those teeth, you don't want to end up with an infection. Infection can be a trigger for a flare. We want to minimize infection and inflammation as much as we can so that we don't get flares. The same is, should I have my wisdom teeth removed? I go back to Dr. Kaplan's analogy of waking the bear. We don't want to wake the bear if we can possibly help it. And for those of you with FOP, you'll know exactly what I'm talking about. However, if the wisdom tooth is going to cause long-term chronic issues, then it's very likely that it's a good idea to get that taken out. Now, when we should get that taken out is again debatable, but it's something that you should discuss with myself, Dr. Desidue, and your dentist with respect to when's the best and what you're wanting to do with that. What is your best advice for a dentist treating someone with FOP? In this instance, my best advice is not to the dentist, but it's to you as the parent or the individual with FOP. I want you to become your best advocate. Most dentists do not know anything about FOP. You're the one who is the expert. You know more about your condition, your disorder, than any dentist will ever know. And it's important that you share the guidelines with any oral health professional. And if any time they have any questions, they're most welcome to contact myself or Dr. Crow, and we will help discuss something with them. So I want you as the individual or you as the parent to become your best advocate. And so I think that's the piece that I want to highlight here for you. You are the expert, we are not. If my teeth have been sealed, should they be resealed when I am older? Now, sealants are interesting in that we normally seal teeth at the time when they are at most risk to get disease. And certainly if the tooth is at risk of continuing to get disease and the seal has been lost, it may very well need to be resealed. However, oftentimes we seal the top portions of the teeth, but today there are methodologies where we can actually seal between teeth or at the root portion of the teeth. So there are other things other than sealants that can also be used today that can stop the process from occurring. So the answer to that is absolutely. If there's no harm to it, why not? So those were the questions that actually came from everybody before. And I'm looking at the questions here, Hope. I think we discussed the use of mouthwash during the presentation. So unless, Evelyn, you have something that we didn't discuss that you want to know, please ask. Laurie, that's a very interesting question. Is it a medical necessity or is it elective? I actually would say that it's a medical necessity. I don't think that I personally would not consider that as elective surgery. I would say that it's a medical necessity because you're wanting to minimize the risk of developing either a flare or having a complication from something at a time when you're in crisis that you cannot treat. Because removing impacted teeth with locked jaws is not an easy process to do. And it is complex and does have its risks. So I think what you have to look at is what is the risk-benefit ratio of doing something versus not doing something. And here is where Dr. Desidue would be the person that you really want to get that answer from.
So Clive, actually, Felicia was just asking what the question was. The question that Lori was asking,
sorry.
Felicia, was would having teeth removed because of being impacted with a locked jaw be considered elective or a medical necessity? And I'm guessing that Lori may have been asking that question for insurance purposes, possibly, that maybe insurance might not cover it if it was considered elective surgery, or if that would be considered medical necessity in the FOP community. So that was what the question was.
Me personally, I would write to the insurance company saying that it was medical necessity.
And then we did have just one other question that came in through the chat. It was about thin toothbrushes for small openings. And so I know Karen went over some tools for that. And I would just say, if you have any additional questions about, creating something like that, the Ability Toolbox would certainly be happy to help kind of problems.
Yeah, Joseph, you're more than welcome to reach out to me directly, either email or we can have a Zoom call. And I'm happy to try to problem solve with that with you if some of the specialty brushes that we listed today still aren't quite right for you.
Well, that was all of the questions that I had seen come in. So if no one has any other questions, that will conclude our webinar for tonight. And I just want to thank again Dr. Friedman and Karen from the IFOPA for taking some time to go over this very important topic with us.
There is one more question that Felicia has sent in, and I'll just read it for you. My daughter's dentist has used silver diamine fluoride on some of her baby teeth instead of a filling. I'd never heard of this, but it seems like a really useful alternative for FOP patients. Actually, it's an extremely excellent use of a medicament that we have today, not only for FOP, but in terms of COVID. The use of silver diamine fluoride is a game changer in terms of minimizing risk for getting disease, for getting cavities. And if you actually have a cavity starting, it can actually stop the process from occurring. So silver diamine fluoride, I think, is an extremely effective and useful tool in the FOP population for sure, both adult and child. So great question, thank you.
Thank you, Felicia, for sneaking that one in at the end. Great. Well, if anyone else has questions, I know that Dr. Friedman, his contact information is already available online, but we'll also have it posted with the slides and the recording of this webinar, which will be available on the IFOPA website later this week. So thank you to everyone. I hope you enjoy the rest of your evening.